United we're as strong as a mountain.
This is Steve Zeltzer with Workweek, and we've been covering the struggle of UC workers and also the role of the University of California in takeovers of hospitals or buying 8 hospitals in California, but apparently they don't have enough money for the workers. And there's also a struggle going on at Children's Hospital over the takeover by UC. And joining us today is Stephanie Lum Ho. She is with the National Union of Healthcare Workers. Healthcare workers. Welcome to our show.
Thank you. Thank you for having me, Steve.
So, Stephanie, what kind of work do you do?
I've been working at Children's Hospital for 12 years now, and I'm in the business office clerical bargaining unit, and I do authorizations in our physical therapy department, outpatient.
And you've been working with the union there?
I have been, we established recognizing NUHW as our representing union in 2017.
And what's happened with your struggle? Because I know UC is spending millions of dollars, or, these management spend millions of dollars to fight unions. Was there a battle getting a union?
Yes, it was a battle getting our union, and it became an even bigger battle once UCSF affiliated with us back in 2014. So currently what UCSF is doing now is they're calling it an integration to integrate the UCSF hospitals with Children's Hospital, which is a private hospital, and UCSF is a public hospital. So, what UCSF is doing is wrong and dishonest. This integration is disguised as wage theft. I'm not here to work at Children's to get rich. I'm here to do a great job while I'm serving our children and community. But what I didn't expect UCSF to do is to come up with this phony integration plan to cut our take-home pay and then to increase our health and retirement benefits. This does not improve the healthcare in Oakland or the kids in the East Bay. It just makes it harder for us to make our ends meet as families and to keep the staff and services on the East Bay.
And the question is, why should healthcare workers pay for healthcare? They're working in hospitals. That's another real question, because at UC, against the AFSCME workers, while they were in negotiation, they imposed healthcare cost increases while they were in negotiation, which is an unfair labor practice. So the question is, so they're taking it over, Children's Hospital, and they want to basically force you to pay more for healthcare.
Yes, they are. That is exactly what they're trying to do. I have a plan where I don't have to pay any I don't have to pay any portion for my medical benefits, for my spouse or for children. So I'm going to have to do something that I haven't had to do in 12 years as a CHO employee, and that's not right.
And the cost of living is very high. I mean, workers are having trouble making it to survive rent and everything else. Yet the Regents apparently and UC have billions of dollars for basically corporate takeovers, corporate mergers. What's really behind this?
They're doing that new construction at Children's where they're saying they're disguising it again as better patient care by building this brand new emergency department. But at the same time, they're also reducing services for our most vulnerable. So they can do two things at once by building and making more inpatient beds, but they're also reducing services that our vulnerable community needs, like our early intervention services, our neonatal follow-up services, where we have social workers that go out to the public and meet with our families so that our kids in our community can thrive.
So when they were taking it over, didn't they promise they were going to protect the services?
Yes. So they said the only thing that would happen with the affiliation is that they are going to slap the UCSF logo on the building and nothing else would change, that our services would stay the same. We'd still have our grant funded programs, which we are also losing employees to attrition. So we have our grant funded programs. When they lose employees, they just don't get filled in. And that's just part of our community that no longer gets served. So they have all these billions of dollars and they choose to give bonuses to They're leaders, but yet at the same time cutting our very needed programs.
And they say that they want your union to be replaced by the other UC unions. What is involved in that? Because shouldn't workers be able to stay with the union they want? And are they trying to fight your right to stay with the NUHW?
Yes, they are trying to fight us. They want to force us into a union that we didn't recognize. We are proud that we negotiated strong contracts with competitive wage scales and less expensive benefits than other UCSF employees. We need that money to provide for our families, to spend right here in Oakland, in the East Bay. UCSF's attempt at wage theft, they're funneling that money upwards and across the Bay to San Francisco. UCSF shouldn't be able to strip away our union that we democratically recognize to represent us.
And talk about the wage theft. How is that taking place?
By this phony integration. We should be bargaining a new contract instead of them forcing us into this integration, into they're forcing us into positions with less take-home pay without negotiation, no contract negotiation, no bargaining in good faith. They are just stripping it from us without collaboration.
Isn't that union busting?
That is union busting. It is UCSF pitting unions against each other. And unions are good for everyone, and they are pitting us against each other. We've created strong contracts that only benefit other contracts. When we bargain our new contracts, we look at General, we look at Sutter, we look at what their wages are in comparison to ours, and that's how we get higher wages, because of other contracts that are already established. So,
and the corporate mergers that are going on in healthcare, UC is arguing now that they have to be competitive with Stanford. They have to be competitive with, Kaiser. They're in a competitive war, and therefore the workers have to take cuts for them to be more competitive. Where is that going? Because it seems these healthcare monopolies are basically pitting worker against worker and trying to basically attack the very workers that provide the services and the profession and the needs of people in healthcare.
Yeah, it's creating infighting. And then what's going to happen there is they're also trying to integrate us to create easier staffing for UCSF. We have 2 time systems that keep us separate. But once they merge those 2 time systems, we're all the same employees and we can go across the Bay. So if they have 10 employees missing over there in the West Bay, they're going to just send us over there, which creates less employees here in the East Bay. They're sending our patients over to the West Bay for services. It's just minimizing what we can do here and support our community. And then it also puts a financial burden on our families who have a hard time as it is to get to Oakland. And then they have to go over to San Francisco to get services. Our hospital's been around for 100 years. A lot of our employees have been around 20 plus years. We are seasoned children's specialists. And our kids see the difference when they go over to the West Bay. It's every worker should be able to choose their own union, and no worker should have their take-home pay cut so that their employer can boost its profits. We're here. I've been in the healthcare area for a while, so have my parents, and it's always been about we deserve healthcare. It's a right, and it's becoming a business and a corporation, and that's the crux of it. It's about profits over patients.
And the University of California is supposed to be a public institution. The Board of Regents are appointed by the governor, Governor Brown previously, and now Governor Newsom. Many of them are multimillionaires.
Yes.
There are no labor representatives on the board. it seems that this is a corporate board basically representing the billionaires and not working people and not the public as far as California is concerned.
That's right. And when when the workers don't have a voice at the table, we get screwed. It's hard to get our point across when we're not at the table. We don't have a voice, and the only people that are speaking are the people that are made of money and who want to continue to make money
And
on the backs of their employees.
the CEOs have got massive salaries. They have homes. I mean, there's going to be a strike tomorrow of AFSCME and up TCWA, and the money that's going into capital expansion is massive. While they can't make their ends meet, and they are also having increased healthcare costs. It seems like it's forcing healthcare workers and UC workers themselves, as well as yourself and your union, into a battle with the people who run the UC healthcare system.
Right. And it shouldn't be a battle. They continue to say how this will improve patient care, but we can't improve patient care when we're at war with each other. It's the refusal of UCSF to want to work together with us, which is what's frustrating. And this is a community.
What excuse did they use why they can't work with you, negotiate with you?
Well, we've gone through the grievance process to go through this integration. We feel that what they're doing is wrong. We are now in the third step where we're trying to pick an arbitrator, and they refuse to pick an arbitrator because, as their attorney has said, the hospital can do what they want to do. So
they're above the law?
It sounds like that. The way I interpret it, yes.
And the other thing is what's going on nationally with the Trump administration. They want to get rid of Medicaid. They don't believe in public unions. They want to privatize all public resources. How would this impact your hospital and others?
Right. So as Children's Hospital, we are a community hospital that serves about 70 to 75% of our Medicaid, Medi-Cal patient. So that would deeply impact us as far as being able to serve our community, as far as these patients are able to go anywhere to get any types of services. If their Medi-Cal is cut, the medical care would be scarce and hard for them to find.
And you're going to be out on May Day?
Yes. We will be having an info picket and rally out in front of Children's Hospital Oakland tomorrow, May 1st, from 12 to 1, where we'll be there to hand out information, inform the public about what's going on. We're launching another petition. As we've said, we are a strong union and we are willing to do what it takes. We are not going to stand idly by while UCSF forces this integration on us. This is not a foregone conclusion that this is what is going to happen. We are going to fight. We're launching a petition to take the temperature of our NUHW members and see what we are willing to do moving forward with this fake integration.
So you're fighting back on May Day.
We are fighting back on May Day. We are inviting our elected officials. We are inviting the media, all of our parents that will be there at the hospital for treatment. We're having them come out and, inform them of what could happen if they force this on us. It's not just the employees, it's also the community that will be affected. It's an info picket, no strike, no work stoppages, just more of an informational picket.
Okay, well, I want to thank you very much for joining us on Work Week. We've been talking with Stephanie Lum Ho. She is a member of NUHW. The healthcare workers have faced major attacks in the United States, and one of the issues facing healthcare workers is mergers and corporatization of healthcare. And today we're going to talk about what's going on at Children's Hospital, which is being taken over by the University of California. Joining us is Sal Rosselli. He's the past president of National Union of Healthcare Workers. Welcome to our show, Sal.
Thank you, Steve. I appreciate your interest.
So, Sal, why don't you talk about what is happening at Children's Hospital and the fight of members of NUHW to keep their union and why UC wants to basically merge them into the other unions?
Sure. First of all, our union has represented members of children's hospitals for a long time, and currently we represent 1,300 folks, virtually all of the eligible union employees, with the exception of the registered nurses and doctors. So service workers, technical workers, professional workers, psych professionals, etc. And a number of years ago, Children's Hospital in Oakland affiliated with UC, and immediately we started seeing reduction of services for people in the East Bay, moving services to San Francisco with less accessibility to East Bay patients and East Bay children. And our union has been on the forefront of struggling and forcing UC to maintain this extraordinary quality care in the East Bay, these services. So a couple of months ago, out of the blue, UC announced that all children's employees, effective July 1, were going to be employees of the University of California. And by virtue of that, they would be forced into other unions that represents UC employees. So our 1,300 folks would be forced into 3 separate unions, no longer united. And the contracts of those separate unions, on average, the compensation is $10,000 less per employee than what our members have achieved over these years at Children's Hospital. So a couple of things. One, this is not a merger. This is not UC taking over Children's Hospital. The affiliation continues. We've attempted to go into bargaining both with Children's Hospital, reaching out to UC executives, fruitless. They refuse to talk about it. Our attorneys have filed a lawsuit that is unresolved. We're waiting for the appointment of a judge to deal with a potential restraining order against this outrageous top-down move. So that's in the courts. Last month, we hired a third-party organization that who's in the business of conducting union elections for employers and unions. And we had them conduct an on-site vote of our 1,300 members without NUHW's involvement at all. And the result of that vote was 98% want to stay unified in their union, National Union of Healthcare Workers, and not be forced into these other unions. So that's the story, Steve. We're being stonewalled. We're not being given any answers. Yesterday, all employees at Children's Hospital got this notice from UC saying, you have until May 30th to make a decision about whether you become UC employees, go into other unions, take these reductions in compensation, or you have the option of retiring. And we'll supply you with a minor severance if you opted to retiring or not be rehired. So that's where it's at. From our point of view, the UC system is controlled by UC Regents. A majority of them are appointed by the governor and approved by the California Senate. Others by their elected position, like the lieutenant governor and the speaker of the assembly, are automatically members. So we're appealing to this body of elected/appointed to do something about this and prevent it from happening. We've talked to a number of the regents and are awaiting their response. Finally, I would just say, I hope this is obvious to you, it's just outrageous. It's Trumpian. It's top down, like negating the democratic will of workers to choose a union. And again, it's the UC system forcing this to take wages away from workers and to have this money go into UC's control.
And
I'll add one more thing, Steve. And I started by these comments by saying, when this affiliation started, we started being on the defense, fighting to maintain patient care. What UC, has in mind in terms of transferring services to San Francisco as opposed to maintaining in the East Bay, forcing not only caregivers to work in San Francisco, but patients that need the care needing to travel to San Francisco is just an enormously negative issue for both access to care issues and the caregivers themselves.
And of course, tomorrow, May Day, UC ASPE 3299 workers are going on strike, UC system, UPD CWA members are going on strike, and they've been negotiating, and the Regents have been unilaterally, in the case of ASME, increasing their healthcare costs. You're working at a hospital and your healthcare costs are going up. You're paying for healthcare, which you shouldn't be, really. You work in a hospital. And it seems like the Regents and the UC management are spending millions of dollars on union busting lawyers to fight the unions. Is that your experience?
Well, that is apparently what UC is doing. Again, regarding the Regents themselves, again, we've reached out to the president and a number of other Regents who, frankly, reacted to me not knowing about this. So they are looking into it. We're awaiting their response.
Well, it seems like this is not isolated. There have been a number of unfair labor practice strikes by the other UC unions. Are you in favor of legislative hearings? Because the legislature should be doing oversight of the fact that they're basically a frontal attack on not only UC workers, but now apparently on your members who want to stay in your own union.
Absolutely. If this is not resolved, again, they're saying they're unilaterally gonna do it effective July 1. This battle will not be over on July 1 from our point of view. And certainly we would call on the governor and California government to do something about this. Again, it's Trumpian, right? It's what the federal government is doing. Do not have that expectation to allow something like this happen in California.
And the president of basically telling workers what union they can belong to, it seems like that's a very dangerous precedent. If they can say to workers, you don't have a right to belong to NUHW where you're already represented by them, they can do that to other unions throughout the state and public workers.
Absolutely. Again, it's something that we're seeing from the federal government in terms of taking away workers' voice, voters' democratic processes. Do not have that expectation to have it happen here in California.
And Project 2025, you're probably aware, is for the complete privatization of all public education, public hospitals. They're against unions in public institutions. They want to set up company unions. Are you concerned about the danger of these attacks and the rise of fascism in this country?
Absolutely. The dismantling of the government, the ignoring, laws, ignoring the Supreme Court, going after judges, arresting judges, deporting citizens, let alone the way they're going after folks that, are undocumented or are in other different, phases of immigration. It's frightening. We've never seen anything like that in this country, obviously, in our entire history.
And what's happening with the other unions? I know those unions that represent UC workers, ASME and UPD are on strike. Has there been any effort to have a united front with all the unions that you see? I mean, you're facing the same employer, basically.
Well, first of all, I reach out to the other unions at this point. We're not getting any indication that they support this whatsoever, even though they set the gain in terms of union members. Again, from our point of view, the focus is on the Board of Regents that
Unknown caller.
our understanding has the ability to stop this.
And what can people do who want to support your effort for staying with NUHW and against the kind of wage cuts and concessions that they want from you?
Well, certainly, we have this rally tomorrow where folks are kicking off a vote to strike to bring attention, right? To bring public attention, media attention, political attention to this horrendous situation. Our website, nuhw.org, can direct folks to how they might help and get involved in this.
And your union is also involved in a long strike against Kaiser, mental health care workers in Los Angeles. What is happening with that? Because it seems like Kaiser is taking a hard line. They don't want to have parity with the mental health care workers in Northern California with Southern California. It seems like they want to try to bust your union. Is that the sense of what's going on in Los Angeles?
Well, they certainly, Kaiser, 15 years ago, 5,000 mental health professionals that work for Kaiser joined our union, and we have been in a war with Kaiser Permanente since then to try to force Kaiser to provide the behavioral health services to their members that, one, are legally required, that Kaiser members pay for, and that's needed. The strike in Southern California is 2,400 behavioral health professionals. It's going into its 7th month. And the issues are not trying to break new ground with Kaiser. They're simply to achieve what Kaiser does to their workers in terms of benefits on their medical side and patient access issues, which Kaiser agreed to with our union in Northern California 3 years ago after a 10-week strike. Not trying to break any new ground. They're the issues. Governor Newsom and the union has called for mediation. And finally, Kaiser did agree to go into mediation. We were in mediation this past Monday, and hopefully we're going back into mediation by the end of this week to try to resolve this almost 7-month strike. Simultaneously, just coincidentally, Steve, yesterday, we have 2 bills that we're sponsoring in the legislature to focus on mental health parity. One, specifically mentioning Kaiser and saying that after the settlement, we won a $200 million settlement against Kaiser 2 years ago for not providing adequate mental health care. That this one bill says that Kaiser members that have had to go out of Kaiser network to access mental health care that Kaiser refused to give deserve and should be getting compensated for that. So turn in receipt and get compensated for the care you had to go outside of Kaiser to receive mental health care. And the second bill is around compensation. There are federal parity laws that not only provide parity for access to care for people needing behavioral health, parity with medical care, but parity for compensation for behavioral health caregivers compared to medical workers. One of the strike issues in Southern California is that Kaiser pays its mental health professionals 30 to 40% less than radiological technicians, physical therapists on the medical side that have even a lesser of an education and experience than the mental health professionals. Both of those bills passed committee yesterday overwhelmingly with hardly any opposition.
Well, under federal law and state law, these medical associations, Kaiser, others, are supposed to provide mental health care. It's a requirement. You think they should be criminally prosecuted, these CEOs of Kaiser and others who basically are blatantly and flagrantly saying we're not going to follow the law and we're going to allow people to commit suicide because they can't get health care? I mean, they're basically, people are dying because of the fact that they're not provided prompt health care for mental problems.
Well, I think the next step that we have to achieve is the Department of Mental Health Care, DMHC, is the California department responsible for enforcing laws with plans, health plans in the state. They're not doing it. They're not structured or funded to enforce laws. Since the strike began 7 months ago, we have filed 14 formal complaints with DMHC to, detailing the lack of access to care as required by California laws. We've gotten the results of none of those investigations yet after 7 months. So certainly something needs to change and to get the state government to enforce these very good laws that we're passing.
And as you know, UC has spent money to buy 8 hospitals. They want to be in competition with Sutter and Kaiser and other chains. There's a national rally on May the 31st calling for national health care to get rid of the insurance companies and the hospital association who are in charge of health care. Do you think, and also with the attack on Medicaid, which is going to have a massive effect, I know at Children's Hospital, a lot of people are on Medicaid, Medicare, that may be cut. You think it's time now to really build a national campaign to get rid of the insurance companies and the hospital associations being in control of healthcare as well as the drug companies?
That's something that leaders of our union have been working on since the early 1990s. We currently help lead a coalition called Healthy California Now. Scores and scores of organizations like ours and community and medical MD organizations that are dedicated to achieving Medicare for all, a single payer system of healthcare. So it's more than the time to accomplish that. Unfortunately, with this current federal government administration, we're not going to be able to accomplish it nationally or even in California because of waivers that are needed from the federal government. So it certainly needs to be part of an escalating national movement to bring attention to the fact that our healthcare system is so fragmented. Just tens of millions of people don't have access to care. Others that are insured don't have access to care, which is what we've been talking about here. Appreciate your interest, Steve, and count on us if you want more information.